Hi there, Dr. Tallarico here. I'm going to talk a little about acid reflux and GERD. So one of the things that people think, or one of the things I hear very often is, I developed acid reflux because I just have so much acid in my stomach. And so what I have here is a graph. And what this graph really shows is where acid levels are as a person ages. So if we look here, here's the age, 11 to 20 years old. They have the highest level of acid in their stomach. And then as time goes on, we see it go down. So if high acid levels were the reason that people develop acid reflux or GERD, then all these 11 to 20-year-old kids would be developing GERD. But in fact, here's really the beginning incidence of this problem. So we have almost no incidence, and then all of a sudden we start to see it. So this is called an inverse relationship. And in fact, if we look here, when all this stuff begins to happen, the most cases of GERD and acid reflux occur as acid levels are dropping. And that's kind of like a that's an inverse relationship. Yet, this is where you'll be treated. This is where you're going to be given medications to lower hydrochloric acid, which is the acid that your stomach makes. And the reason that that acid is there is really, really important. It sterilizes the contents of your stomach. So when you eat things, the acid kills things like bacteria, virus, other organisms, parasites and things. But more importantly, it digests things. And so it helps to digest your proteins, breaks them down into the amino acids, and it liberates the minerals. So when you eat foods that contain calcium, for example, the hydrochloric acid enables that calcium to be pulled out of that food and then to be digested and used. So if you take away acid, what do you suppose might happen with those types of things? Okay? So this is a real important thing to understand. You don't have too much acid. In fact, a lot of reflux, a lot of GERD happens because the stomach acidity has gone down. And then you're going to go, what? What is this guy talking about? Well, it turns out that the hydrochloric acid creates a chemical signal that causes the top little valve in your stomach, called the lower esophageal sphincter, to close. If that sphincter is completely closed, no acid gets on your esophagus, and therefore you don't get GERD or gastroesophageal reflux disease. In fact, you could have a stomach full of acid and stand on your head and not get GERD or not get reflux if that sphincter is doing what it's supposed to do. And again, the big chemical trap, the big chemical signal is hydrochloric acid. So we need to look at some of the reasons why this is occurring, and it occurs in a very high amount. And then we're going to also talk about some of the side effects that occur when you use these types of medications to lower your acidity. But first we got to establish you need that acid. It needs to be there. It's doing a very important job. Okay, so one of the things that happens is over time the acidity goes down, and that causes the sphincter to stay open. With that sphincter open, even a few drops of acid from your stomach getting on your esophagus is going to cause heartburn. It's going to cause something, because the esophagus doesn't have the bicarbonate mechanism that the stomach has to neutralize that acid. So the esophagus is very susceptible to damage. And so the thinking is we're going to protect the esophagus from damage by taking away the acidity. But then we're kind of leaving off this part where it says, wait, this acidity is actually doing something that's very important. We need acid to do lots of things. So let's run down a few things, a few signs of low stomach acidity first. First one would be when you eat, if you get a lot of bloating or belching or gas. You also may have weak fingernails. You may have some rosacea, some redness in your face. You may have a lot of intestinal infections. You may be susceptible to a lot of diarrhea, you may have some undigested food in your stool, or you may just have like sick stomach, dysbiosis all the time. Those are some signs that you have low stomach acid. And now here are some things that are probably going to be shocking. Here's some of the diseases that people have that are hallmarked with low stomach acidity. Addison's disease, acne, asthma, celiac disease, rosacea, autoimmune diseases, diabetes, eczema, Graves' disease, rheumatoid arthritis, multiple sclerosis, hepatitis, lupus, osteoporosis, hives, and ulcerative colitis. You can probably throw in there irritable bowel syndrome too, because sometimes irritable bowel is kind of marked by some dysbiosis as well, where you're not really doing a good job digesting. So hydrochloric acid is super important, and it initiates some of the other phases of digestion. So after you eat foods that contain fats, carbohydrates, and proteins, you need different enzymes, and they're called pancreatic enzymes, that help to break down the food all the way. So HCl, hydrochloric acid, initiates that chain of events. And so if you don't have enough HCl, your regular digestion in terms of your pancreatic lipase, amylases, and proteases, they don't work as well either. So in general, you can develop some deficiencies of some very, very key nutrients if you don't have enough stomach acidity. One of them is going to be B12. And the reason that is B12 comes bound to proteins when you eat it. And so when you try to break that apart and you don't have an adequate hydrochloric acid to stimulate something called pepsin, you can't break that apart and then have the intrinsic factor pick up the B12. So you develop some problems with B12. One of those problems is anemia. Another one might be dementia. It could be that you develop some multiple sclerosis because you don't have adequate B12 to make myelin. You can develop problems with your homocysteine levels, which is real important for your cardiac function. So this is just really important. To just shut this off, to just take this away, ignores this, because we need that B12 to optimally break down our, not B12, we need that HCl to optimally break down our food. So just turning it away, just turning it off isn't the answer. Also, we need hydrochloric acid to help us absorb calcium, and we need it to help us absorb magnesium. Two very, very critical minerals to the body. So if we have low calcium levels, the first thing you think of is osteoporosis. That's exactly right. If you can eat and swallow as many calcium pills as you want, but if you can't digest and assimilate that calcium, you're not going to get the benefits of it. Okay, so that's really important. The other one is magnesium. And so low mineral levels can cause all kinds of problems, muscle issues, fibromyalgia. It's just something that just in general the body needs to be well. And you can throw in a lot of disorders here because health, it really starts in the stomach in a sense. You're eating foods and you have to be able to digest and assimilate. And if you just throw a switch and turn that off, you're not going to be optimally healthy. So some of the big causes of the problems that people have is hiatal hernia, whereas basically the opening here in the diaphragm is too big and the stomach is kind of pushing up around there. One of the ways around that is eat smaller meals. Pay attention to your posture. If you're very slumped over, you're sitting at a desk for a long period of time, you're putting a lot of pressure into your abdomen. I find that patients have problems in their spines that correlate to the nerves that go to the stomach, so the middle back. They typically have very forward shoulders and heads and very rounded backs. And they have heartburn. And so if we fix that and those nerves going into the stomach get better, then they start to notice that they don't have as much heartburn. Also, certain foods can switch this on and off. Sometimes you have a food allergy or a sensitivity, and that can do it as well. And one of the biggies is also dysbiosis, or problems with the gut biome, where you don't have healthy organisms in your colon. And so because there's that element of digestion isn't working right, you may have injured those organisms with taking antibiotics or hormones or antihistamines, and those organisms aren't doing their job, and so you're not evacuating the waste products as well as you should, and that kind of backs up the whole system, and so you're just not moving things through. You don't have peristalsis, or movement through the GI tract the way you're supposed to, and things just are starting to back up, like the line is backing up, and so you're just noticing, oh, I eat something, I get heartburn. Well, it's like everything is kind of slowed down, so we need to move that along. Other things are infections. So some people develop something called H. pylori, which is an infection that affects the stomach itself. And the treatment, unfortunately, a lot of times is antibiotics, which affect the lower digestive apparatus. So there's some natural things to do. There's supplements that can help, but what I suggest you do first is start to eat smaller meals, and then start to really look at some of the things that you're doing that could be, causing the problem to get worse. I wouldn't eat a big meal and lay down. I wouldn't eat food with an enormous amount of drink because you dilute the stomach acidity. I would eat smaller meals throughout the course of the day. Now, there are great supplements. I usually start people with stomach acid. I usually give them what's called betaine hydrochloride with pepsin. Those are two really critical things to do to actually get digestion to work better. But the answer isn't just taking a bunch of supplements. It's really looking at how do we get people well through diet and lifestyle modifications. So it's a really important topic, and it's just something that it kind of bugs me because a lot of people are doing this, and then we're seeing people as they age, as they get older, they develop all of these different health problems, and they don't even think about that it could be linked to their digestion and their poor digestion going on here. So really begin to drill down on this and think about what we can do to do better. If you need some help in terms of digestion, you can also take enzymes themselves, like some pancreatic enzymes or a multi-phase enzyme with hydrochloric acid, which is called betaine HCl. And sometimes I like to include pepsin in there, which really helps with proteins. But we'll see, when people have low HCl levels, they're going to develop mineral problems, they're going to develop vitamin problems, especially B12. There's also some literature that says that people can't absorb vitamin C as well. So all of these things can be improved upon if we can restore normal digestion. So it's really critical. So postural issues, smaller meals, taking a probiotic, or even better yet, eating fermented foods. And I'm not talking about the yogurt that you buy in the store. I would rather see you eating or drinking something like a kombucha, or some good sauerkraut that, like grandmom used to make, or some good fermented foods. Most of the commercially available yogurts offer very little in terms of organisms. They're just really loaded with sugar, and it's one of these foods that people eat when they think it's healthy, but it's really not that healthy for you. Eat smaller meals, and then be more active, physically active. Don't eat a giant meal and then lay back on the couch and then go, oh, I got heartburn. It's kind of like the way it's going to happen that way. So this is important. This is something that you can do. I'm just looking at everything, make sure I've covered all the bases. But yeah, hydrochloric acid is important, and you don't have more. As you get older, you have less. And so that's the actual reason why more people develop GERD and esophageal reflux disease when they get older, not when they're young. Thank you.